Disease Index. Nervous System Diseases Part 1. Dementia. Welcome to this clinical profile on dementia. Dementia is a progressive clinical syndrome. In medical terms, a syndrome is not a single disease entity, but rather a cluster of symptoms that consistently occur together. We call it progressive because it follows a persistent downward trajectory where the pathology worsens over time. The primary presentation of the dementia syndrome involves two distinct categories: cognitive and behavioral symptoms. When we discuss cognitive symptoms, we are referring to the brain's processing power. This includes memory loss, but also significant impairments in reasoning and communication. In a clinical setting, this is where we observe a loss of executive control. Executive control is the brain's ability to manage itself. It is the conductor of the mind that allows us to plan, focus, and reason through complex problems. When this control fails, the patient can no longer organize their thoughts or find the right words to communicate. Beyond the cognitive, we see a marked shift in personality and behavior. This isn't just moodiness, it is a fundamental change in the patient's temperament. They may become unusually withdrawn or increasingly irritable as the neurological pathways for social conduct begin to degrade. The diagnostic threshold for dementia is often reached when we see a reduced ability to carry out daily activities. These are the basic activities of daily living, or ADLs. If a patient can no longer manage the sequential steps of washing or dressing, it signifies that the brain can no longer execute the automated programs required for independent life. While the symptoms define the syndrome, the underlying cause varies. Alzheimer's disease is the most common type, representing the majority of cases. However, there are other common types, including vascular dementia, dementia with Lewy bodies, mixed dementia, and frontotemporal dementia. To summarize, dementia is a systematic, progressive decline that affects thinking, behavior, personality, communication, and ultimately the patient's total daily function.